Good evening. This is my presentation on a research paper that I read off of PubMed on concussion. Concussions are currently a public health issue. That's the reason why I decided to choose this topic overall for both this assignment and later on in the course for my final presentation or my final project. Um, Research from separate studies show that too many athletes either don't report their concussion symptoms, they are not removed from play in enough time, and they return to play too soon. The following is the research paper that I chose to do this presentation on. It is the Young Brain and Concussion Imaging as a Biomarker for Diagnosing and Prognosing. So basically this research paper goes over what a concussion is, how can we increase awareness, in what ways are, research being developed for concussions, in what ways are we learning about neuroimaging and the pathophysiological changes in patients who experience a concussion. Basically, there is no if and then statement type of hypothesis. It's more so a review of other papers and other findings that may contribute to a better understanding of the neurological consequences of TBIs, specifically concussions. And this, in hopes, in this paper, they hopes to lead to the development of different brain biomarkers to improve the identification and prognosis of pediatric patients who do suffer from concussions. So, starting off in the intro of the paper, it went into detail what a concussion is, and it is a traumatically induced transient disturbance of brain functions. It involves a complex pathophysiological process. In the paper, it discussed a lot of different definitions for concussions, and that too points out just how new concussion research is and just how uninformed people are about it. That there's not necessarily one specific definition, but this was one that kind of summarized up all of the definitions that were stated in the research paper. The prevalence that was in the research paper was the basics. TBIs contribute to 30% of all injury deaths. About 75 to 85% of TBIs are concussions. Americans spend $76.5 billion in medical care and rehabilitation and loss of work each year. So in the introduction, there was just basic prevalence numbers just to give you a background of how prevalent TBIs are in America. So who's at risk? This is very important. The previous history of concussion patients are most at risk. There's also new findings that maybe genetics has something to do with being at risk for having a concussion. It's also dependent on the type of sport you play, the position, and the actual individual playing style. Are you more aggressive than the next player? And also, the pre-injury psychiatric disorders. Those type of patients are a 17-fold increased risk. At a 17-fold increased risk of having a concussion or enduring a concussion after impact. There's insufficient evidence to identify age or sex as a risk factor. So, a little bit more background. Your brain is basically like a human helmet. There are different layers in the brain that go into protecting your actual brain tissue once upon impact. And that's your pia mater right here, your arachnoid, your dura, and the outer layer that we are all well aware of is our skull. And the paper also, along with other concussion papers, discuss the COOP and the counter COOP. So this is a sequence of impact after enduring a concussion or during endurance of a concussion. So your initial impact is called a COOP, and your secondary impact is when your brain rebounds, and it's called a counter COOP. Sometimes these things can happen separate from each other, but often they happen together. Okay, so digging deeper into what the paper discussed, as stated above, there's somewhat of a hypothesis stated that they wanted to be able to point out the pathophysiological changes after TBI, after a concussion, and the symptoms that correlate with those. So here you have a few. Ionic flux correlates to having a migraine, a headache. Impaired neurotransmission correlates to having impaired cognition and slow processing, slow reaction times, and so forth. A few symptoms of concussions, starting off with the acute symptoms, so symptoms that don't last for long and they happen right away. Headaches, nausea, dizziness, tiredness, and emotional distress. The most prolonged symptom that can occur or last as long as a month or a year is a fairly new term, post-concussive syndrome, and this was discussed extensively in the paper. Um, Prior concussions may have a long-lasting effect on the behavior of the patient. It can induce mood and conduct disorders such as ADHD and depression. Both the ICD and DSM have classified what a concussion actually is. They're a little different in their diagnosis for post-concussive syndrome, but it's pretty much the same thing. To have three plus of the following symptoms, that's headaches, that's fatigue, disturbance of sleep, impaired memory, anxiety, personal changes, dizziness, insomnia, reduced tolerance for stress or emotion or alcohol. Mood disorders. So patients are very susceptible to mood disorder changes if their prefrontal cortex is not fully developed. PCS may also, I've stated before that PCS may increase the pre-existing disorders that are already there. So if a patient already had depression, their depression symptoms can increase after having a concussion. Disorders include, again, depression, ADHD, anxiety, and conduct disorder in pediatric patients specifically. Another important part of concussion studies is how to diagnose them. How do we do brain imaging? And that was another aspect of the abstract for this paper. So there's three different ways to diagnose a concussion currently. Impact is fairly new, mostly for high school athletes or college athletes, athletes that come straight off the bench into the attention of a PT. They take this test, this online administered test. There's also a CT scan and MRI that we are all mostly familiar with. And the paper will go into more detail about these three different types. And so the first type, impact testing. Um, Impact testing is basically, as stated before, the athletes have a baseline test and a test after and during a concussion. And this can help us recognize a change in memory, a change in reaction time, um, a change in anything, pathophysiologically related to the neurological performance of the brain. And these are three different test examples that will be given or administered to an athlete on a computer. Kind of like games. It's very difficult to follow after you experience a concussion. It's very hard to remember what color comes next, what symbols you saw previously, and that all adds up to a number that your PT can put on a scale and say, okay, this is how severe your concussion is or is not. So when do we use brain injury or brain imaging, such as CT or MRIs? If there's a suspicion of intracranial hemorrhage, a loss of consciousness, worsening or prolonged of symptoms, speech impairments, or a change in vision. So how do we choose between an MRI and a CT scan? The paper basically explained that CTs are faster and cheaper. They're best for immediate screening, but they're not sensitive enough to detect much change like an MRI is. So you kind of have pros and cons of each. There are two different types of MRIs. You have the diffusion tensor imaging. It's fairly new and was described in the research paper. As you can see, between the normal and the minor traumatic brain injury patients, there is a change in white matter connectivity. So it's DTIs measure white matter integrity, the average diffusivity, and the fractional anisotropy anisotropy in the brain, and this correlates with post-concussive syndrome as found in the research. We also have resting state fMRIs that are becoming more and more popular. They compare brain stimulation between, the patient at norm and the patient after having a concussion. So as you can see in the concussion patient, there's a lot less activity in the brain after a stimulation, and that proves that there's reduced connectivity after enduring a concussion, and that correlates with cognitive symptoms in concussion patients. Treatment was also discussed in the research paper, and that includes the traditional pain reliefs, minor cognitive exercises after enduring a concussion, such as memory tests, playing Sudoku, for example. Something new is taking brain vitamins, such as Q10, vitamin D, B12, and magnesium. After studying with physicians over the summer, this is a little bit outside of the paper, but they also say, why not make the patients keep track of their symptoms every day, see if they're actually improving and following up before actually returning to play. So some future studies could include, creating an actual golden standard of treatment. You have all these different types of treatments now that the paper went into detail about, but which one is the first go to? Which one do we go to first? And that was kind of a weakness in the study. I mean, it went through all the possibilities, but it never honed in on what was the best thing to do um, for a physician. If I was a physician or if I was a patient and I was trying to figure out what was the best option for me, the paper kind of gave us the overall general information, but didn't really point us in the right direction as to what was best for us. It's also more specific to pediatric patients. But as a 21-year-old student who still endures concussions because she is an athlete, I can't necessarily compare myself to what's been given in the paper because I am not a pediatric patient anymore. And my brain development is a bit different. The way I endure impacts and concussions may be different from, you know, adolescent athletes as well. So that is my presentation, and I look forward to expanding on concussions using RStudio later on in this course.